Lesiuk, and I'm going to be demoing Foley catheter insertion today. So before we get started, I'm going to review the physician's orders. So for February 7th, 2021, it is 07:36, and the doctor has ordered to insert the Foley catheter now to monitor fluid balance closely, monitor ins and outs. So we have for nursing Jake, date of birth January 1st, 1960, and we have our patient has no known allergies, so it is appropriate to do that. So now I'm going to clean my hands, and I'm going to verbalize that pericure has been done prior to this procedure. So clean my hands and collect my supplies from my clean supply room. Once I have my supplies, I'm going to go over to the patient's room. Upon entering, I'm going to do an entry safety check and everything that entails, which is the bed in the lowest position, call bell within reach, patients in no distress, and then I will introduce myself with my name and designation. I am Alex Lesiuk, student nurse at the University of Manitoba, and I'm going to be inserting your catheter today. So after that, I will ask him, could you tell me your name and birth date? So once he does that, I'll verify that. 2 identifiers with his wristband here, nursing Jake, date of birth January 1st, 1960. And do you have any allergies? He says he doesn't have allergies, so that's good. After that, I'm going to explain the procedure. So today we're going to be inserting an indwelling Foley catheter as per doctor's orders using sterile technique. We're going to insert a tube which goes in your urethra, and the tip will be in the bladder, held in place with a balloon, and that will constantly drain urine into a drainage bag, so we can record the output closely, record your ins and outs, and he is okay with that and will cooperate with the procedure so we can move along. After that, I will pull the curtain to maintain privacy. Then I'm going to adjust my bedside table, so I'll raise that to waist height. I will clean the table off and put it into the appropriate position here, close to the bed. Then I will raise the bed, raise our patient's bed to waist level as well. After that, I'm going to pull out our drainage bag. So we'll throw that in the garbage there. And I'm going to hook on our drainage bag to a non-movable portion of the bed. So once that's hooked on, I'm going to attach the tubing to a part of the sheets there so we can access it later, keeping the tip sterile. Once that's done, I'm going to pull the covers back, our patient here, and I'm going to assist our patient into the appropriate position. So that's supine with the thighs slightly abducted because he is male. And I will place an absorbent pad underneath him. Then I'm going to pull the gown back, exposing his genitals. So once we are at that point, we can go ahead and I'll do hand sanitizer, and I will remove the contents of my kit here. So I'll put my sterile gloves at the end of the bed here and the catheter tubing there as well. Then I'll pull out my I'll pull out my kit here and inspect it to make sure that it's intact. Open it up and place that on my workspace here. Then I will, holding in the 1-inch border, open the first side, the second, and then the other side. And I will get my forceps, grab the 1-inch border there, pull that one. Now I'm going to pass my garbage bag to me. I'm going to open the garbage bag up and place that at the patient's feet. Next, I'm going to open up our sterile drape, making sure only to hold in the 1-inch border there. And I will put that between the patient's legs, like so. Now I'm going to open up the fenester to drape, hold in the 1-inch border again, and place that over the genitalia like that. Now that that's done, I'm going to grab my Foley catheter. I'll wing it open appropriately so we maintain sterility of the inner package. And I will use my forceps and pull it out of the package, throw that in the garbage, and add this to our boat. Once that's like that, I can do hand sanitizer, and I will go to the bedside and open up my sterile gloves. I can throw that in the garbage there. So I'm going to start with the right hand first, and then the left hand, like that, and I can leave that like that. Then I'm going to go to my boat and pull out my Foley catheter from the bag, and I'm going to throw that in the garbage, keeping my hands at above waist level. I'm also going to inspect the tip, so the tip is intact. I will pull out my swabs, open the swab package, and throw that in the garbage. Then I'm going to open up my sterile water syringe and attach it to the balloon port. Then I will grab a lubricant package, open that up, throw the top out. Then I'm going to lube up a portion of our catheter there. Alright, once that's done, I'm going to move our tray between the patient's legs. So once that's done, I'm going to note that our patient is circumcised, so we don't have to worry about retracting the foreskin. So I'm going to grab the shaft of the penis and clean in a circular motion from the meatus to the base of the glans. Now that I've cleaned, I'm going to tell the patient that I'm going to be inserting the Foley now. I'm going to instruct them to bear down and take a few deep breaths. So here we go. Because he's male, I'm going to insert at 6 to 8 inches until I see urine. So I see urine now. I'm going to keep going another 1 to 2 inches to make sure that we are in fact out of the urethra in the bladder. So there we go. Now I'm going to move my index and thumb to stabilize the catheter tubing at the tip of the meatus there. So for when I inflate the balloon, which I'm going to inflate the balloon with the sterile water. Once that is inflated, I'm going to maintain palm pressure on the syringe. Gently pull on the catheter until I feel light resistance. So there's light resistance is felt. That means that it is held in place. I'm going to remove the syringe, throw that in the garbage, and place my catheter on the edge of the boat there, like so. After that, I'm going to get our tubing for the drainage bag, remove the cover there, and maintaining sterility, I'm going to attach it to the catheter. Make sure that it's good and on there. Once that's done, I'm going to perform peri-care, clean up any excess lubricant or cleaning solution. I'm also going to clean up the supplies we used here, throw them in the garbage. I'm going to attach this tubing to his leg with a stat lock or a tape, and then I will remove my gloves, throw them in the garbage, and do hand sanitizer. After that, I'm going to make sure the patient's comfortable, and I'll lower the bed to the lowest position, Then I will make sure the call bell is within reach, ask them if they need anything else before I go. They say that they don't need anything. So then I will leave the room and I'm going to document on the procedure. So as per doctor's orders, at the appropriate time, using sterile technique, we inserted an indwelling Foley catheter with a 14 French catheter held in place by 10 ml balloon with 10 mLs of sterile water. The patient tolerated the procedure well with no pain, and the catheter went in on first attempt. And we got a 250 ml return of pale amber aromatic urine with no foul odor and no sediment, so no signs and symptoms of infection. I'm going to continue to monitor for any signs of UTI, also monitoring their ins and outs closely, and I'm going to document on the nursing IPN as well as the ins and outs sheet that is usually located on the patient's door. So once I do that, I am done for the insertion.
Okay, so now you have a new order to remove the Foley catheter.
Alright, so as per doctor's orders, I'm going to review the orders and make sure that it's appropriate to remove the catheter, and so the patient can void on their own now, and that's appropriate. So after that, I'm going to clean my hands and collect the supplies. So we're going to collect a 10 ml sterile syringe and an absorbent pad and clean gloves. After that, after I have my supplies, I'm going to enter the patient's room. Upon entering, I'm going to do my entry safety check, so make sure the bed's in the lowest position, call bells within reach, patient's in no distress, the appropriate side rails are up, and then I'll introduce myself. Hi, I'm Alex Lesiuk, student nurse, University of Manitoba, and I'm going to be removing your Foley catheter today as per doctor's orders. And could I get your verbal verification of name and birthday? So he will tell me his name and birthday, and I will compare that on the wristband here. So we got Nursing Jake, January 1st, 1960. That's good. And we could ask about allergies at that time as well. So once I do that, I'm going to explain the procedure to the patient. So as per doctor's orders, we're going to be removing your indwelling Foley catheter today because you can void on your own. So we're going to be taking the balloon, deflating it, and pulling the tube out of your urethra, and then watching so that you void within 8 hours, at least 30 ml, and he's in agreement and accepting the procedure, so we can go ahead with that. So after that, I'm going to pull the curtain to maintain privacy. I'm going to fix up the bedside. I'm going to raise the bed to appropriate height. And then I'm going to position the patient in the appropriate position, so legs, so supine with legs slightly abducted, and because he is male. And then I'm going to put the pad under his butt there, the absorbent pad. And then I'm going to do hand sanitizer, apply clean gloves. So these are now my clean gloves. I'm going to empty and record the drainage bag, the amount that we got, so 250 ml of pale amber aromatic urine. That was the last output there. We'll record that and empty that. So once I'm done that, I'm going to then remove the tape or the stat lock that's holding the catheter to the patient's leg. So I'll remove that, throw it in the garbage. I will grab my syringe and insert that into the balloon port there. And then I will tell the patient that I'm going to be removing the water now. Let him know what I'm doing as I'm doing it. So I'm going to make sure I do remove the full 10 ml. So I'm certain there I have the full balloon deflated. Now I'm going to tell the patient that to take a few deep breaths, that I'm going to be removing the catheter. So there we go. and it's out. I'm going to inspect the tip of the catheter to make sure that it's intact and nothing is left in the bladder, so that's intact and it's all good. Next, I'm going to throw this and the catheter and everything in the garbage. I'm going to clean up the bedside, perform pericare. I'm going to remove my gloves, throw those in the garbage. I'm going to make sure that the patient is in a comfortable position. I'm going to wash my hands after I take the gloves off. Make sure that the patient is comfortable, make sure that the bed is in the lowest position possible. Call bells within reach, they are comfortable and they don't need anything. After that, I will leave the room and do my exit safety check. I will document on the procedure, so as per doctor's orders, we remove the indwelling Foley catheter because the patient can void on their own now. We used clean technique. We removed a 14 French catheter held in place with a 10 ml balloon with 10 mLs of sterile water. The patient tolerated the procedure well with no pain. The removal of the Foley, we removed it with no resistance. The tip was intact. The last void that we emptied was 250 mLs of pale aromatic amber urine with no sediment, no signs and symptoms of infection. We will continue to monitor to make sure the patient voids within 8 hours on their own, at least 30 ml. And I'm going to make sure to document all of this in the nursing IPN as well as the time. I'm going to document the time the procedure was done and on the ins and outs sheets. That is usually located on the patient's door. And that is it.